tests that you need to do before marriage, before getting pregnant, and also before what you call intimacy. Very crucial tests. I'm going to say about 6 of them that are very crucial that you need to know. Remember to subscribe to this YouTube channel. Remember to share. Remember to like. Also leave a comment. Let's know what you want us to do in the next video. Now, one is what we call the men and women wellness. This checking for the chronic conditions such as the hypertension, diabetes, and what we call the liver condition, kidney conditions. Now, once you know these conditions, it's not that you need to run away from your partner because she or he has some conditions of this chronic. But again, is to know the care that just you'll give the half if your partner needs care. Because again, if there's any complication, you need to give care, you need to call the doctor, you need to take your partner to the hospital. So it's something that to prepare your mind, not to run away. The other thing is what we call the genetic testing. Some of the conditions, they usually pass to the children from the parents through what we call the genes. The albinism, what we call the sickle cell disease. So by doing this genetic testing, you'll be able to know any genetic condition. The other thing that you should know is all about the blood group testing. This is very crucial when it comes to pregnancy. We have what we call the blood group A, B, and O. We have the rhesus negative and what we call the rhesus positive. Now, the rhesus negative, this when it comes to pregnancy, you need also to have what you call to see the doctor. If you become pregnant and you have rhesus negative, you need to see the doctor for further management. Because if you are a woman with the rhesus negative, it means that you are lacking the protein. The rhesus factor is just a protein in the what we call the red blood cells. But there are those people who usually lack this protein and therefore they are rhesus negative. But if you are a woman and you get married to a rhesus positive and you are a rhesus negative, you are more likely to have what we call the rhesus incompatibility, and this may complicate your pregnancy. Therefore, once you know it, once you get pregnant, you'll be able to go to the hospital to be given what we call the anti-D, So therefore, it's good to know your blood group. Test it so that you can be able to know before you get pregnant, before you engage in intimacy. Now, the other test that you need to do is what we call the sexually transmitted disease screening. You need to screen yourself, you and your partner, of these sexually transmitted conditions. Get the viral testing, HIV, hepatitis B, and what we call the human papillomaviruses. Bacterial testing of this sexually transmitted disease, syphilis, gonorrhea, chlamydia, all those sexually transmitted disease. It's good that you and your partner, you be aware. You're not going to test this because you want to run away. You're going to test this condition. Not that you don't want to get married, but again, it's because you need to know the health of your partner and what you need to do is any complication, and you can also assist your partner to take the medication as prescribed by the doctor if he or she suffering from a certain condition. So it's good also to do this sexually screening. And also some of the sexually conditions, if are not treated, they're more likely to cause what we call infertility, both in men and women. So it's good to get tested earlier and then you start the medication at the earlier stage. The other tests that you need to do, you know, before this pregnancy, intimacy, and marriage, mental health testing. There are those conditions such as the, schizophrenia. We have what we call the bipolar conditions, neurodevelopment disorders. All these conditions, they are good to know them. Not that you want to run away from your marriage, you don't want to engage in any sexual activity, but again, it's good you know them so that when, again, if your partner is doing a weird thing, you should be able to know that he or she needs medication. You should be able to know that he or she needs to be taken to the hospital, also needs some care. You understand that my partner, is suffering from a certain condition, So these are some of the tests that you need to do. The other thing is what we call the fertility testing. This is to check for the viability of your sperms as a man and the egg as a woman. As a man, you need to check your hormones, the testosterone, do the testicular ultrasound. And as a woman also, you need to check your hormones, the progesterone, the luteinizing hormone, the thyroid hormones, do the pelvic ultrasound, All this gonna help you to know if you are fertile. So again, you be aware that I have a problem with, or I'm struggling with infertility, and what you need to do, you ask the gynecologist so that you can be able to get the right medication for you to have a baby, So this a very crucial test that you need to do, before marriage, before pregnancy, and intimacy. They'll just help you to have a healthy relationship. Thank you very much. This is the end of this video. Thank you.